you talk to us a little bit, Kim, about what your experience was like during the trial? And you said you're now off the trial, is that correct?
I'm off the trial because the trial ended, but I'm still on the drug. So a pharmacy calls me every 4 weeks, asks if I still have the same address, if I have any questions, and they just mail me the drug. So I've paid nothing for the clinical trial, and I still pay nothing for the drug.
And, and during the clinical trial, what was your experience like? Did you feel like you had a lot of extra doctor visits or a lot of
Yeah,
extra visits to the clinic?
so much attention, like nothing. One of the first side effects I had was sun sensitivity, and that's sort of never been an issue for me. And I think it was April or May, but I happened to be wearing flip flops, and I ended up getting blisters on my hands and my feet. And so when I went in and the doctor saw that, all of a sudden now I have a dermatologist and, just so much attention. I never had to call and make the appointments. They made everything for me. Um, and there was always a lot of attention and a lot of medical care. So, and all the nurses and research, they felt like my family. They knew everything that was going on in my life. They knew my family, and so it was very reassuring, very comforting.
Wonderful. And did you have any problems like with getting back and forth to doctor's visits, or were they pretty um, easy to get to? And was it convenient? What did it inconvenience you at all, or did they work around your schedule?
They worked around my schedule, but also fortunately I live close to Mass General, so that hasn't been challenging. So they definitely. And then when I was closer to the end of the trial and I decided I wanted to get a job and go back to work, they even scheduled something for me at 7 a.m. So it's always been very convenient. And I could do some Zoom call visits.
Excellent. So looking back at your experience on the clinical trial, was there ever a point where you felt like you were going to have to come off the clinical trial because it was too difficult?
Several times, actually, because sometimes, the drug builds up in your body, and my blood count, my counts would get very low, my platelet counts would get very low. So um, I probably stopped it 3 or 4 times and took a little bit of a break. And then the longest was 4 weeks. And the longest you can stop the clinical trial is 4 weeks. But by the end of the fourth week, my labs were back up and I went back on the clinical trial. So my dosage has been reduced each time. And for the most part, I just feel so normal and so healthy.